Hi, this is Tori Stevens with ERM Regenerative Medicine Show, where we have the world's leading functional medicine doctors and cutting-edge practices to help restore your health. Today, we have Dr. Joseph Clark, who's a medical doctor for Aspire Rejuvenation Clinics in Orlando, Florida, Pittsburgh, Pennsylvania, at aspirerejuvenation.com. Again, that's aspirerejuvenation.com. He has 20 plus years worth of experience in the medical board certification emergency medicine, certified in advanced bioidentical hormone replacement therapy. Born and raised in Pennsylvania, has a BS in biology, a doctor of osteopathic medicine, and a master's degree in healthcare administration. Welcome, Dr. Joseph Clark. Hi.
How you doing today?
Excited. I'm so excited. So I know we talked a little prior to the show, but I want to just give our audience an idea of how did you get started? And you started somewhere with the idea that you wanted to help people. You tell us.
So I'm, like you said, I've been a physician for crazy almost 24 years now. I mean, I graduated from medical school in 2000, so 24 years. And, my career kind of started as an emergency physician. I'm still an emergency physician, board certified in emergency medicine, but I got into kind of the hormone replacement and health optimization kind of stuff about 5 or 6 years ago, mainly because, I was seeing younger and younger people in the emergency department that were coming in for more chronic illness that just we weren't really doing much with in terms of medicine. We were putting them on medications. We were treating symptoms. We were seeing more and more people that are in their 20s and 30s that are on 15, 20 drugs, and they were still coming into the hospital because they just weren't feeling well. And so it's becoming more and more of a frustrating situation as a physician in that it just seemed like you weren't really helping anybody, Mm-hmm. And then I had some health issues, just wasn't feeling right, and approached my doctor at the time and did some treatment and some studies to see where my labs were at and hormonally where I was at, and things were way off. And after getting on proper treatment and feeling better, I thought, this is something that's really helped me. I really have a lot of interest in this and really wanted to learn more about it. And help people like I was helped. And so it kind of led me into this path of medicine, and I really enjoy it. I really think it's a very gratifying thing because you see people legitimately get better, things that have been chronic illness that have gotten better, things that you're actually really treating the root cause of the problem rather than putting them on something that treats a symptom. And so, I think it's great in that it allows you to get more out of the years of your life. A lot of times, especially women in general, women are told when they hit menopause, well, that's just how it is, and you're just going to have to deal with this, and you don't have to do that. And, that puts a strain on yourself and your relationship and how you feel, and, it can cause weight gain and health problems and all kinds of other stuff that we can talk about. But, I think that it's just been a real gratifying situation to, treat men and women that have these problems that they seem like, they feel like they're maybe not hearing, or their doctors maybe aren't hearing them, when they see them about these issues. And so I really enjoy doing it.
I think that's awesome. I was taking a look at your website. Again, that's aspirerejuvenation.com. And I mean, you deal with so many, not just hormones for men and women, but you also have peptide therapy. You have HGH, human growth hormone. It helps people that work out and, just want to stay youthful and young and have their beauty back and their strength and vitality mentally, physically, emotionally, and in the relationships of all kinds, physical, sexual, emotional, friends, husband, boyfriend, girlfriend. So I see you have even quizzes on here hormone replacement therapy, testosterone replacement therapy, and some interesting things. Human chorionic, how do you even say that? HCG. What is
Gonadotropin, yeah.
that?
So that's an additional thing that you can take with testosterone to maintain your natural ability to make testosterone while you're on testosterone therapy, or you can use it as a monotherapy to help your body make more of its own testosterone. We're
Right.
seeing younger and younger men now that need testosterone replacement or augmentation, and it's an odd thing which we really don't know the root cause of, and whether it's our food or our use of plastics or pesticides that we use in our food or hormones that we use in our food. We don't really know, but our generation's testosterone levels are way lower than our grandparents' testosterone levels, and so we don't really know why that is. And that's so, like I said, I'm seeing more 20s and 30-year-olds with testosterone issues. But the issue with going on testosterone replacement at that age is that it can affect fertility, which, if people want to have a family, is a big problem. So there are other ways to take and improve your testosterone levels so that you can maintain your fertility. And HCG is one of those options. And clomiphene is another option that raise your natural testosterone levels without changing your ability to be fertile. So, so those are options for maybe younger men that may not want to dive into, full-on testosterone therapy in their younger years. So, there's a lot of different options. You don't have to necessarily marry yourself to testosterone replacement right away,
Right.
and that's why we do a consultation. We typically do a consultation where we have a set of labs that we look at with a number of things in terms of data points with hormone levels, and we look at your lipids and your kidney and liver function and a number of other things. And then we sit down and we talk about them and come up with a potential plan. And then it's really up to the patient to decide what they want to do from there. But, we try to tailor it to the patient, it's not a one size fits all kind of thing. It depends on the patient, their age and what their goals are and so forth. And so we try to, make it something that they're comfortable with and so on.
So the only real difference between, say, a medical MD and, say, your profession as a doctor is that you can offer more than just medication and surgery, right? It's basically,
yeah. I mean, as an osteopathic physician, I mean, we learn everything that an allopathic physician or MD learns, but then we also learn manual manipulation, somewhat similar to chiropractic manipulation. We learn that too. Our philosophy is a little bit more holistic than the allopathic route. The allopathic route and our MD colleagues are more about prescribing and treating symptoms. That's just kind of their philosophy. Whereas the osteopathic philosophy is about treating the body as a whole and giving the body the inherent ability to heal itself. And so that's kind of the root basis of the osteopathic physician. Now, what I do now with hormone replacement, it does kind of fit into that too. I'm not a holistic physician. I wouldn't say that I'm I kind of am, I guess, but I don't bill myself as that. I still treat patients if they have medical issues, just like I would treat them if I saw them in the hospital. But at the same time, I think you do have to look at the big picture, what's going on with everything, not just this one little thing, because it all ties together, especially the hormonal system.
So you started out as an emergency doctor and progressed from there, continued your education. And so then you landed in more of functional medicine. And I think that's wonderful, because then you're not limited to just medication and surgery. You can move on into the education of healing, actually getting to the root causes and healing the body the more natural way and the way that God designed it. So not limited any longer. So I
think that's important, because there are a lot of things that, conventional medicine, may or may not support. And it doesn't mean that it's not right. It doesn't mean that it doesn't work. That it's just, I think there's a lot of bias in medicine, especially, and especially with regards to hormonal therapy. The whole basis of hormonal therapy, in medicine right now, there's kind of a stigma to it, in that if you go to your family doctor and they're an older generation physician, they may say, "Oh, hormones are bad. That'll cause cancer. You shouldn't take that," or you'll get blood clots. And it's really incorrect information. If you look at the data behind it and you look at the evidence-based medicine, which is what everybody should do, what is the actual evidence and what does the studies say? The evidence-based medicine basically says that hormonal therapy is very safe, bioidentical hormone replacement. It all kind of comes back to this one study actually in the early 90s, which was called the WHI trial or the Women's Health Initiative, that kind of pretty much skewed everyone's opinion on hormonal therapy for a whole generation of physicians over the last 20 years. And that then influenced a whole generation of women, unfortunately. And so, for the last 20 to 30 years, everyone's been kind of against it. And now when you look back at that study, even the principal investigators that did that study have said, that study was flawed and they did it only with synthetic hormones, which have been shown to cause cancer. But when you go back and do it with actual bioidentical hormones, which are the hormones that you make in your body right now, the studies show that it's actually a benefit. And so in terms of osteoporosis and Alzheimer's dementia and weight gain and fractures and all of these things that, we see in medicine now in older people, we've kind of let that happen because we've had this incorrect stigma with hormonal therapy. And so, the tide is starting to change. There's the newer generation of physicians have kind of become more evidence-based and are seeing that this is incorrect data. But, it's a whole generation of doctors that have influenced how women have been treated. And it's unfortunate because there's been a lot of women that have been kind of left to suffer, unfortunately, because of it. That, just going to have to deal with it. It's just menopause. You're just going to have to deal with it.
No way.
It's just not the way it has to be,
And as I'm approaching, my 50s and quickly, and a lot of my friends have already crossed over and unfortunately, have lost their jobs, lost their spouse, lost their health and no mobility and enjoying their family and life in general. And can you only imagine if we had this sooner, or if we could get this out, that's why we're here, is to just get this information out to so many people who are suffering needlessly at a fraction of the cost. If you understood the cost of this on a monthly basis, you would scream from all of the things that you've gone through and had to go through needlessly. So it's very affordable, and it's made of all natural substances such as yam. So it's incredible. Synthetic, so pregnant mare urine, so horse urine is what you were taking, and the synthetics, what is it, like 10 years ago, and the regular MDs are still prescribing that today. But here we are, here we are in the natural, field of medicine, and we're able to provide so much more. That's, like you said, it's advanced bioidentical hormone replacement therapy, so ABHRT, as opposed to synthetic hormones. So you're able to provide them at a fraction of the cost, and the medical, as we all know, the pharmaceutical companies don't want anybody getting a hold of this, so they're like, no, we're not going to cover it. But sometimes some physicians do have insurances, available. Does your practice have insurance available?
We typically don't. We typically handle mostly by cash-based medical service, but we do use some insurance in terms of for the medical labs. Okay. And there are some medications that we can do through retail pharmacies that are covered by insurance partially. So we do, I will say we use it kind of partially, I guess. There's some things that the insurance companies just won't cover because they feel it's medically unnecessary. Testosterone is a big one. They feel like, a level of 300 is just fine for everybody. And that's just not the case, But unfortunately, like I said, you just have to kind of take the matter in your own hands sometimes And that's what we're here to help with,
And
really.
I love that. Let's see, what has the effect of the WHI trial been on the last 20 to 30 years of hormone replacement treatment in women?
Yeah, like I said, that trial really kind of
Mm.
influenced everything, for the last generation. And there's the people that have done that trial have come out publicly and said, it was very flawed, and that it was done with synthetic hormones like Premarin, which was,
Right.
made from mare urine and things like that. And those have been found to cause cancer, and the
Mm.
risk is very real for those. But when they go back and do those same studies with bioidentical hormones like you make, like regular estrogen and progesterone, like you make in your body, they find that the studies show that they're actually beneficial and very beneficial. And so, it kind of put a biased spin on medical therapy for a long time, generation, basically, of women that were really told that they can't take this, you just can't take this. This will cause cancer, and
Right.
they were left to deal with very bad symptoms, and had suffering relationships perhaps. And, I see that all the time. People come to me and they're, it's a very important thing. Your relationship is very important. And when
Yes.
people, come to me and they say, hey, if I don't fix this problem, I'm going to end up divorced or separated, or, my significant other's going to leave me, that's a very real problem,
Yes.
and so, you take care of those things fairly easily. You can
Mm-hmm.
change somebody's life and change the trajectory of their whole, future. So, it's a very impactful thing.
So we've talked about some of the benefits. So basically mental clarity, your beauty, your skin tone, your muscle tone. And I know you're an osteo, so you're into the bones, and that's very important when to keep muscle on, because in order to have good bones, you have to have good muscle, correct?
Yeah. I mean, plus, as you age, there's little things that are important. Can you get up off the floor if you fall down?
Right.
Can you maintain your posture? Can you walk a distance without being tired or fatigued? Those are things that
Yeah.
come along with just maintaining your bone density and your muscle density. Once you get osteoporosis, you cannot reverse it. It is irreversible. You can only
Mhm.
slow it down. So the goal is to stop it before it ever becomes a problem. And the more muscle density you have, the more muscle you have, the more muscle will cause better bone density. So
Mhm.
as you age and you lose muscle density, you will lose bone density as a result, because there's no muscle pulling on the bone anymore.
Right.
So the more muscle that you can maintain as you age, and I'm not saying you have to be muscle bound, but just maintaining the muscle you had in your 30s and 40s when you're in your 50s and 60s is very important, just for maintaining muscle or maintaining bone density. And so that's prevention of osteoporosis and prevents all that problem from coming into play. Because, as an emergency physician, one of the things that I see the most is when older people fall down, they break a hip, or they fall down and they have a spine fracture. Those things can basically end their life. I mean, if you're in your 70s and 80s and you fall and you break a hip, you may have a long road ahead of you, and you have a lot of risk going to the operating room and so forth. So if you can prevent those things from happening, you can really, keep someone on the planet a lot longer.
Yeah, and with muscle as well, it helps people to be able to deal with any blood sugar disorders. So it helps you metabolize better. And so there's so many people in the United States that are dealing with blood sugar issues and being able to, and I do realize that a lot of what we do eat and all of the things that they put in the foods today has a giant effect on our ability to function and be able to put any kind of nutrients in our body. Whether I see women with less hair. I mean, if you look 20 years ago, I mean, at our grandparents, they had lots of hair, youthful, vibrant. You see, the difference in the generation. And I can't help but think, about the next generation coming, what they have to deal with. And so it's so wonderful that we have cutting edge doctors such as yourself who are willing to be the cutting edge of everything that we're looking for to solving a lot of our, almost all of our issues, really, marital, I mean, physical, mental, emotional, it is all integrated. So so what are any potential harmful risks in hormone replacement therapy in female patients?
Honestly, there's risk with everything, and there's risk with taking an aspirin. If you knew the risk with even aspirin therapy nowadays, this would never be approved by the FDA if it were a new medication. But if you look at the risk with hormone replacement, estrogen specifically does raise your risk if you take it alone for breast cancer by a few percent. But if you take it along with progesterone, progesterone negates that risk and actually makes that risk less than if you were taking nothing at all. Meaning that if you were on no hormone replacement and you just wanted to know what your breast cancer risk, your risk would be higher than if you were taking estrogen with progesterone, because progesterone is breast protective. Okay. So as long as you take estrogen with progesterone, your risk actually goes down. There is risk with taking estrogen alone. So you should not do that. Even if you don't have a uterus anymore, there are doctors out there that will say, oh, you don't need progesterone because you don't have a uterus anymore. That's really incorrect, because you have to negate that risk of estrogen therapy on its own. So there are, risks that you have to be aware of. Now, if you've had breast cancer before and it was an estrogen sensitive breast cancer, then obviously you want to use some caution there, and you want to, stay away from that. In terms of blood clot risk, the things that you want to be careful with, if you've had a prior blood clot, then, there are certain parts or certain types of hormone replacement you probably should stay away from. Oral estrogen is going to have the highest risk in terms of clotting risk, but topical estrogen is very, very safe, less than 1% risk in terms of blood clot risk. And so there are options for you. You just have to kind of know what the options are and know what your risk is prior to starting anything. But you look at it too in terms of, well, what if I didn't do anything? What are my risks? Well, yeah, my risk is I could, have a terrible life, have sexual problems that I can't get over. I could develop diabetes because I have weight gain problems, and I could have, Alzheimer's, dementia because of all that. So there's other things that come into play other than the risk of just these couple things, so you kind of have to weigh the good and the bad with everything, obviously. Most patients, I think, see that and they understand that, well, yeah, there's risk with everything, but I'm willing to accept this very, 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 very small risk to feel better for the next 20 to 30 years of my life, knowing that, they're going to be good years. They're not going to be miserable years where I'm going to have all these other, sundry medical problems. So I think most people understand that and they accept those potential small risks.
Okay, so that says a lot about, people that have cancer. It answers a lot of their questions. What type can I use? I can use the cream. I can, and you can monitor that. And so I'm guessing that you monitor them very closely. You continue to take blood tests, and how do you monitor when they're at the level that they're supposed to be? Is that
Yeah, so we do blood work about every 4 months or so, just as a general rule, just to kind of see where their levels are at and adjust if needed. Obviously, if there's something that's a problem or they're having an issue, we can check labs anytime. But on a general basis, about every 4 months, we check blood work and then adjust doses if we need to with our goals. We have kind of our unwritten rules as far as where we want to be with our levels of different types of hormones. So estrogen, progesterone, for instance, there are somewhat levels that we're targeting. So we're trying to hit those levels with our doses. And so if we aren't getting there, then we adjust them higher or lower or what have you. So there is a process. It's not just, here's take this and, see you in a couple of years. There's a process. You have to be on them, and you have to, maintain blood work so we can make sure that you're on the appropriate amount and you're getting what you want out of it and you're feeling better. That's ultimately the goal, that you're, feeling better. You don't want to just take this stuff and not feel better. And you want to get to the goal of, actually having it benefit you,
I love that.
So, yeah. So that's the reason why we're checking blood work pretty
And
frequently.
it's also an increase, a slow dose increase to make sure that, they're
Right.
not going over what they need. I love that. So what are the impacts of sexual dysfunction in men and women as they age?
Yeah, big question, because, like I said before, a lot of people come to us, somewhat shy about things, and this may be something that they really haven't had either time or ability to discuss with their doctor, or they feel like it's been passed over with their doctor. They may bring it up with their doctor and they may say, oh, here, just take these Viagra or Cialis or what have you for the males, or they may say to the women, well, it's just menopause and it's just how it is. You're just going to have to deal with that. When, at the basis of what we are as humans, I mean, is companionship, men or women. And so, you want to maintain that. You want to have a good relationship. You want to make sure that your sexual health is important and working properly. And so it's a big part of our practice, and it's not that we just handle that, but it usually always has some kind of tie-in to patients when we're treating them, because if that part of your life is better, then everything seems to be better. Most people will say, they maybe not even realize it right away that it was a problem, and then they start this and they say, on the first follow-up or the second follow-up, like, oh my gosh, everything is so much better. Like, I didn't realize how much I was suffering with that until it was better. And then, we'll see one person from the relationship, and then we'll somewhat soon see the other person because they want to feel as good as the other person, so it's a very important part of what we do. And, it's an important part of us as humans to make sure that those things are working well. And it's just an important part of life, and like I said, I think a lot of times people feel like, it's just passed over and, oh, take this pill and it'll help these symptoms. But there's root causes that could be fixed, that could fix those problems, testosterone in males, for instance, testosterone in women, even, so those are things that can help those problems.
So what I've heard, and I have a lot of girlfriends, we're part of a women's group to help kind of connect with each other, but also to help our community. And what I hear, I also have a marriage group that we have, and I get all up in their business and personal. So we talk about sex, we talk about every part of the relationship. And because, walking into a relationship, you first start out, maybe young, youthful, as beautiful as you can be. And then you get comfortable. Maybe you guys start eating, you go through COVID, everybody's gaining weight, eating the wrong stuff because now they're afraid to go to the store and get the fresh stuff. And then here in the Northwest, it's only available in the summertime, locally. So, we've all gone through the weight gain, the hormone changes, the stresses of life. And now we're all facing, some changes that need to be made. And we're all doing the best that we can to implement what we've been learning. But what I'm hearing is that you have such a very amazing key that has been created for the general public of all ages, where you don't have to wait. You don't have to wait until your mid 40s and 50s to begin to start taking care of your health. It starts early 20s, 30s, right? Because you
Sure.
start going downhill. You know what I mean? It makes it harder for your own personal body to recover as you get older. And
Right.
then, and so we all know the decline from there. You have, your own DNA and everything that you're trying to keep intact with all of the food processing and things that they're doing today. Your natural gut biome is out of whack because of everything they're doing to even our vegetables at the store. Like, you look at the weak colored plants that we're feeding on, it doesn't have nutrients left in it. And we're being fed synthetic vitamins to try and make our bodies happy and healthy. And nobody knows unless we come on here and we talk about it and educate the public so that they understand that the world's way of doing things is going to make you very sick, even though you think you're doing the best you can. There was a 25-year-old athlete, a friend of ours, who is helping out with our marriage group. And unfortunately, their daughter, she runs marathons. She is a young woman and she has cancer, and is not able to metabolize, sugars or anything like that. She's eating right, thinking she's eating right and doing right. But like I said, what they're feeding her, on the day to day she thinks is going to be good for her health, and it just isn't. And so we're here to bring the best of the best, all the wisdom that from all over the globe, right here at Edge on Regen Med. And like I said, Dr. Joe Clark is one of our finest with 20 plus years of experience. And I encourage you to go to aspirerejuvenation.com and take a look at all of the things. I mean, he's got from peptides to hormones, sexual health, vitamins and aminos, weight loss, aesthetics. He has so much a health gamut of wealth of information for you to delve into and to call and ask questions. I mean, we're just getting barely tip of the iceberg here, just touching on so many topics that I mean, I'm like a kid in a candy store because I have so many friends and family who are, like you said, suffering needlessly. And I'm going to continue with a couple more questions that are asked, for on the daily. What is the difference between bioidentical hormone replacement and non-bioidentical hormone replacement?
Got it. So bioidentical hormones are basically chemically identical to the chemical or to the hormone that you make. I'll use estrogen, for instance.
Okay.
We use estradiol, which is the exact same chemical structure and exact same substance that your body makes, your ovaries make. Okay.
Right.
Whereas a synthetic hormone like Premarin, for instance, or conjugated equine estrogen, or CEE, is basically estrogen from horse mares that are pregnant, that they take from their urine and refine and then put into this medication for you to take for hormone replacement. And it is not the same. Chemically, it is different than estrogen that you are making. Okay. So if you look at the chemical structure, it is different. The others that you make, progesterone, for example, is what you make, chemically identical to what you make, whereas progestins are chemically not the same and are synthetic and are not the same chemical structure, and those are synthetic. Birth control, for instance, are typically a synthetic estrogen and a synthetic progestin, or one or both. Okay, so birth control that unfortunately women are thrown on, and it's kind of forced down their throat from the time they're teenagers, is all synthetic hormone, and it suppresses your natural hormone production because your pituitary gland thinks it's making hormone when it's actually just sensing this synthetic floating around in your body. And so, these things over the course of years when women take them, they have effects on your body because your body's not making the natural hormone that it should. These hormones, I mean, they've done double-blinded placebo studies where they've looked at the study and looked at the data, and they do have cancer risk. They are not the same as what your body makes. They are foreign substances in your body, whereas bioidentical hormones are exactly the same as you make. Okay, and so when you're taking something and it's exactly the same as you would have floating through your veins on a normal basis, what's the risk? It's the same as if you were making it. So, the risk is very minute to none versus a synthetic that is completely foreign to your body, that your body has no idea what this is. It thinks it knows what it is because it looks kind of the same, but it is not the same. So they're very different. They're not the same. And so what has unfortunately happened is that they've both been kind of lumped together as hormones, quote unquote hormones. And so that's where the hormones are bad kind of thing comes together, because everybody's thinking of the synthetic when it really should be discriminated into what one is versus the other. Okay, because they're very different substances and they are very different in terms of the risk, their benefit, what they do to you. And so it's a very important question to ask. And so when I see women, still that are on Premarin, I just kind of shake my head because I'm like, oh my gosh, it should be, but doctors have no problem putting you on birth control. They'll say, don't take hormones, those are bad. Right. But we'll put your 15-year-old daughter on birth control, which, doesn't make any sense. It's kind of hypocritical, but, It's what we do. But that's the difference between.
And I wonder, I can't help but wonder, I know that they're not a pharmacist. If they know what they're doing and they're doing it anyways, how can you in good conscience think that you're going and helping somebody knowing what it's going to do to their bodies is going to be a negative
I
long term
think, yeah, I think
health
a lot
effect?
of, unfortunately, I think a lot of practice for physicians is dictated by pharma, and that, pharma comes in and says, hey, this is a new drug and it's way better than this cheap, non-synthetic thing that you make. It's way, way better. You should use this because this is awesome. And we'll give you some samples and you can give them to your patients, and we'll buy you lunch, and we'll take you to dinner. And unfortunately, it dictates practice.
Yeah.
It's an unfortunate part of medicine. The United States is only one of two countries in the whole world that allows pharmaceutical companies to advertise on television. And the reason for that is because it influences what people do.
Right.
And pharma is, they're very powerful. And I'm not a conspiracy theorist by any means, and I still practice conventionally, but they have a big influence. And, there's a lot of things that we do in medicine that, when you stop and think about it, it doesn't make a lot of sense. Like I said, we'll put your 15-year-old on birth control, which is synthetic hormone, but don't take hormones when you're menopausal because that's bad. It doesn't make any sense.
And more than that is what's going to happen to her in a few years from
Exactly.
taking that.
Mm-hmm.
And I'm learning more about even our cosmetics and what it's made of. We have 1,300 chemicals that they don't allow in other parts of the world, but they allow in the United States to be absorbed into our biggest organ, which is our skin. And we only have banned 11 chemicals as opposed to the 1,300 we allow. And so we really have to keep guard over not just our minds and what we put into our bodies, but on our bodies as well. I mean, from skin sunscreen to, we cannot trust everything that they say for us to do. So I have always wanted to ask this question. What do you use instead of painkiller? What is your go-to?
Well, it kind of depends. I mean, obviously, if I see someone in the emergency department, their arm's broken, then, narcotics are probably the only thing that's going to really fix that pain. But, you'd be surprised how much pain relief women get with estrogen replacement, because it's probably one of the biggest things that I hear from women as they go on to hormone replacement is that my generalized body pain has gotten better.
Okay.
We all kind of feel a little bit like this as we get older. We're like, oh yeah, I'm a little sore when I get up and it aches and pains. I'm not as young as I used to be, but
Right.
women really notice a palpable difference
Mm-hmm.
when they go on estrogen, because it causes kind of an anti-inflammatory effect. And so one of the biggest things that I hear from women is, man, I feel better. Like I don't have as much body pain. And that's very real. The other thing is that there are things that you can, do in terms of peptide therapy are naturally occurring substances that are floating through your body right now that help your body repair and heal. Growth hormone being one of those things. Growth hormone releasing peptides are another one that cause your pituitary gland just to make more of your natural growth hormone. There are substances like BPC 157, for instance, that is a healing peptide. It causes healing factors to go to the area where you're injecting it so that it helps your body heal. So there's a lot of things that you can do that is not, conventional, that helps with pain, helps with recovery, helps with repair, regeneration. So there's a lot of options.
And then there's also, all of these things are so wonderful. If I was, say, your sister, and I'm 49 years old, and I've had long COVID, I've lost half my hair. 3 months after that, I'm trying to help as many people as I can. I had so many people on Facebook who were coming to me, Tori, what do I do for this? We're all wearing toppers, we're all getting hair extensions, trying to fix, some of that. I've noticed aging. It basically took so much out of all of us. And I know people that are still experiencing long COVID symptoms. And they're going for the was it ozone therapy, the oxygen therapy. They're doing shots to be able to regenerate, like you said, the vitamin C and some of the nutrients back into their bones and their body and their joints. But this is something you can do ongoing, and isn't every like 4 months you can just get a pellet, or you can do the cream. There's different ways you can go about this. You don't, and so every so often, and continuously regenerate your body, get your cells back in order, get your mitochondria back in order, regrow your hair, like it was maybe a decade ago, get your skin back in order. You were saying something about osteoporosis, you can't regenerate the bone. I know that we can always, the body makes a new us every 7 years. So whatever we put into it right now makes a brand new you in 7 years. And so I believe there must be a way, maybe it's not discovered yet, but there must be a way to also regenerate the bones as well, the density.
Yeah, I wouldn't be surprised that it's just not something that we've figured out yet.
Right.
Because that kind of stuff is something that we see every day. We find new
Right.
things every day. New peptides come out every day.
Yes.
They're literally ones that we've only had for a few months. That are fairly new. MOTS-C, MOTS-C is one that we just mentioned about mitochondrial health. Helps mitochondrial health. Helps in terms of healing, regeneration, hair growth. GHK is another one. So there's a ton of them out there that have really helped people after COVID and so forth. I see a ton of thyroid problems after COVID.
Right.
And thyroid problems can lead to hair thinning and hair loss. And so there's, the only way you can really tell is really to see a provider, get some blood work, see where things stand, and then just kind of go from there. Because you may be surprised at what you find, and don't be misled by saying, "Oh, well, I had blood work a year ago; it was all fine." There's a lot of, and I tell patients this every day. There's a lot of, there's normal, and then there's optimal. So when you do blood work, conventional medicine is more fixated on the normal, whereas we're kind of fixated on the optimal, meaning that your blood work and your thyroid level could be right at the cliff of falling off into abnormal. But if it's still within the normals, your doctor's going to be okay with that. Whereas we look at it and we're like, well, you're way down here at the bottom. I mean, you should be way up here at the top. I mean, if you want to perform and have, be your best, you want to be up here. So, there's a lot of difference between normal and optimal. I use the analogy of an A and a C minus on a test. If you can get an A or you can get a C, you probably want the A versus the C, because, you're going to feel better, have a better grade. It's the same situation, so there's a lot of that we see. People are like, oh yeah, I saw my doctor, they said my thyroid labs were fine. And I'm like, yeah, they're okay, but they're literally on the threshold of abnormal. And you put them on thyroid medication and things get better, because they had subclinical thyroid problems that were just not being treated. So you have to kind of listen to the patient, see what's going on with them, listen to their symptoms. And if, walks like a duck and quacks like a duck, then it's a duck, so you have to treat them.
And with all of the testimonials that you have coming in, and all of the 5 stars, and all of the positive feedback that we're getting, especially in this field of regenerative medicine, it's a no-brainer. And it spreads faster than marketing ever could. It's word of mouth. It's everybody wants their family and their friends to feel as good and amazing as they should. And like I said, decades ago, I'm sure they didn't need all of this, because they had so much nutrients in the soil. They weren't dealing with all the chemicals. I mean, all the sprays on the grasses even are changing our frogs from male to female. So looking at everything that this generation is up against, they're taking 72 vaccines as opposed to 35, which is what we took until the age of 18. And so, and then continuously making new ones and hoping to God, that they are working, or, Lord knows what they're putting in these days. And I'm just saying that I can't help thank you enough for choosing to go into the natural field and to actually do work on getting to the source of the roots of the problems using natural technology, everything that our body is made of, everything that God had designed for our bodies to be putting into it. You guys have made a way for us to regenerate, even in today's society where it's absolutely clustered with problems coming at us, and the stresses of today that we didn't have yesterday.
For sure.
So enabling us to be able to handle all of the stress factors, even in relationships. And psychologists today are overwhelmed by all of the issues that people are having with their mental health. So I mean, so we could go on and on here, but I just want to say thank you. And again, this is Dr. Joseph Clark. He's a wonderful doctor from aspirerejuvenation.com in Orlando, Florida, Pittsburgh, Pennsylvania. I want you guys to give him a call, give him a shout, take a look at his testimonials. Don't take our word for it. Go on his website, take a look at all of the things that they do. I mean, you are amazing. Look at his history, look at the about, check these guys out, and really do your homework. I know you are. So I've seen plenty of doctors who put this into practice for over a decade now. And I was talking to a doctor yesterday. She is 60. She's skiing at the Alps with her husband, and she looks younger than I do. She looks 40. So it's just incredible. It's amazing what you guys do. And so God bless you, Dr. Joe, and thank you for being on the show. We hope to have you again and again. We love you, love who you are and what you do. And thank you again. Appreciate
All
you.
right. No problem. Thanks for having me.
All right. Take care.
You too.